Okay, so today I want to discuss the Medicare Supplement Plan G. And everybody always talks about this plan. It's known as the most comprehensive plan, the best plan. People say, oh, I have this plan, I never pay anything. Well, I want to show you the raw data as to why this is known as the top plan. So let's jump into it. The Medigap Plan G. When you have your Medicare A and B card, you can attach a Medicare supplement plan to this. And for the most part, most people end up getting a Plan G. I'm going to show you the benefits and the reason why they do this. So for the Plan G, I did a analysis and I came up with an average of what people pay when they're 65 years old. And the premium that they pay would be on average $140 per month. Now keep in mind that's an average for the entire United States. Could be lower or could be higher. And what do you get with this? Well, the only other thing that you have to pay is a $226 a year deductible. That's for 2023. Now, once you pay that first $226, everything else is covered. And some people say, well, what does that mean, everything else? I'm going to go over a list of things. So it covers doctor, hospital, urgent care, outpatient centers, ambulance, wheelchairs, x-rays, blood work, skilled nursing facility care, hospice, prosthetics, and mental health care. And people would ask, well, how much of this does it cover? Well, inpatient, as far as hospital, it covers everything, 100%. Whether you're in the hospital overnight, whether you have surgery, going in and out of the hospital, ER, whatever it is, you will pay nothing after you pay your premium of $140 a month and your deductible of $226 for the entire year. Most people will get rid of this deductible in the first couple of months. They'll pay it off, and then everything else will be zero. So I have over here skilled nursing. You get 100 days of skilled nursing care in a facility at zero cost. Also, your MRIs, your CAT scans, and so forth will cost you nothing after you pay this $226 for the year. So I have over here the max out of pocket is $1,906. Now let me jump into this. So with most plans, people want to know, what is the premium, what is the deductible, and what are the copays? Well, for Plan G, there are no copays. You're not going to pay anything as far as when you go to the doctor paying a copay. What about deductibles? Well, for Plan G, there's only one deductible. That's $226 for the entire year. And what about the premium? Well, I already said that was going to be $140. So let's do the math. $140, you're going to pay that each month. So times 12 will be $1,680 for the year. Well, what else are you going to pay? So we take that $1,680, add that $226 deductible, and in red here, this $1,906 is your entire cost for all of those things that I just listed. So that will be your max out of pocket for the year for your hospital and doctor and so forth. There are a couple things that it doesn't cover, and none of the Medigap plans cover these things. One of them is a drug plan. Now, a drug plan is going to run you between $5 and probably $35. It could be a little bit more, but none of the Gap plans come with a drug plan. But the cool thing is that you get to pick from any drug plan that's offered in your area, a Part D drug plan. So if you're only taking two generics and they're very cheap, $1 or $2 when you go to the pharmacy, you're probably going to want to get on a plan that's $5 a month. So this is going to save you money on drugs. If you take something more expensive, then you'll probably end up getting a more expensive drug plan, and you'll be better off with that too, because you could pick a plan that actually has your drugs in it and they will pay for your drugs. On top of that, the other thing that it doesn't cover is dental, vision, and hearing. I put in here $40. Most plans for this are around between $40 and $60 per month. And you get to pick which plan. Once again, you get to mix and match and pick which plan that you want for dental, vision, and hearing. So some people ask, well, for the Plan G, what companies are the best companies? Well, it depends on your age, it depends on where you live, and it depends on a couple other factors. But for Plan G, the benefits throughout the entire United States And the benefits, no matter what company you get, are the same. So it doesn't matter if you get AARP or Aetna or Blue Cross, or Cigna, Transamerica, Humana. A Plan G is a Plan G. Same benefits across the board. Same thing. It doesn't matter if you're in Florida, Texas, Hawaii, New York, California. The Plan G is the Plan G. Benefits exactly the same. So I hope this video helped. It's very simplistic. The reason why people love this is because it's very clean. You pay your premium, you pay that deductible, and you're done for hospital and doctor's visits. You pay nothing for the rest of the year. Thanks so much for watching this video. Please leave a comment, and I'll see you at the next one.